Here we have Kathy Mull, who is the Executive Director of the Cocoon, and we're so glad that you're here with us today. Um, so we'll go ahead and get started. I guess first, we would love to hear more about your organization and the services that are offered at the Cocoon.
Yes, so thank you so much for having us. So the Cocoon is Wood County's domestic and sexual violence agency. So we serve survivors of domestic violence, sexual assault, sex trafficking, stalking, and we also do some work with adults who were abused as children. And so we provide everything from 24-hour crisis line, where survivors can reach out and access services at any time that they may need them. We also operate an emergency shelter. And so we can house individuals in our shelter facility if they're looking for someplace safe to go. In addition to that, we do quite a bit of legal advocacy in the community. So we're helping survivors file for things like civil protection orders, navigating, criminal court cases, divorce, custody, any of those types of things. We do a lot of financial empowerment work with survivors. A lot of times what we see is that, finances can create a large barrier for them in moving forward in their journey. And so when we can help, hopefully maybe, break down some of those barriers. We are first responders out to the hospital, so we'll meet survivors out in the hospital, whether it's because of a sexual assault or a physical assault, talk with them about what their options are, and help them walk through any of those processes. Really, we say we pretty much will do, just about anything that a survivor may need, and if we can't, then we'll help connect them to the resources in the community.
Awesome, yeah. So obviously with COVID-19 happening, there's been a lot that has influenced different organizations. And we've heard a lot about mental health agencies and how they've kind of adapted to what is happening going online and whatnot. So I was wondering exactly how things have affected at the Cocoon, or if they haven't affected at all, as well as any online resources that folks can use.
Sure, absolutely. So part of the governor's stay-at-home order excluded survivors of domestic violence. And so agencies like ours are considered essential, and so that we can still be there to be the safety net for survivors who may need it in our community. And so we've definitely worked really hard to be able to continue to provide the same level of services that we've always provided to the community, but doing it in a way that also helps, maintain the health and the safety of the people who might be reaching out, as well as our staff who are still responding and providing those services. So we are still taking folks into our emergency shelter. I was just getting some information this morning, and that we've already done 2 move-ins this week for families who are looking for a safe place to go. That being said, we have maintaining social distancing in our shelter facility. We've had the ability to be able to do an isolation suite. That if anybody was to have symptoms, that we could separate folks so that we could help contain any sort of spread of the virus. But our shelter facility is still up and running. We are also maintaining all of our other services as well, and I think I lost you.
We're still here.
Okay, good. I froze.
Yeah.
So if you're good, then I'm good. So we are also maintaining all of our other services out in the community. We're still responding to the hospital if survivors show up. We've worked really closely with the Wood County Hospital and have been assured that our processes will help keep any survivors who are coming in safe, as well as our advocates who are responding. We're still responding to the courthouse for emergency legal needs that survivors may have. Otherwise, we have shifted a lot of our face-to-face contact to telecommunication, video conferencing. So our advocates, instead of meeting with people face-to-face, are doing primarily phone contact or video conferencing with individuals to be able to practice the social distancing. We've also shut down our facility to any visitors in order to be able to help maintain, again, the health and the safety of the folks that are here. So we've shifted a little bit around how we're providing those services, but the same level of services are available. I know you did ask earlier about some online resources. Our website is a great place to go for some online resources. There are also the Ohio Domestic Violence Network, the Ohio Alliance to End Sexual Violence. Both of those places are putting out a lot of really great information for survivors as well, and which are places that they can go to get some information.
Great, yeah. That's a wonderful resource to be able to share with folks in the community. Another question I have, upon actually looking at the Cocoon's Facebook page, I did see that you were doing some projects regarding Sexual Assault Awareness Month. Do you want to speak more on any of those projects?
Sure, absolutely. So April is Sexual Assault Awareness Month, and unfortunately, again, because of the stay-at-home order, we've had to cancel quite a few of our public events, and so we've made some transition to try to do some things online. And so we had three sort of major events planned in the month to bring awareness to sexual violence, and one of those is the Wood County Clothesline Project. And so for folks who are not familiar with that, the Cocoon houses the Wood County Clothesline Project, and it's got close to about 1,000 t-shirts that have been made by survivors of domestic or sexual violence, just protecting, talking about the impact of the violence or bringing some awareness around domestic or sexual violence. And so normally we would display a portion of that publicly, but instead we chose to do that on our Facebook page. And so if you check out our Facebook page, you can see some photos of the display of the Clothesline Project and some of the survivor stories. We also do an event called What Were You Wearing, which is intended to bust the myth that sexual violence survivors are sexually assaulted because of the type of clothing that they're wearing, which we know sexual violence is all about power and control and does not have anything to do with the clothes that a survivor chooses to wear. So the What Were You Wearing event depicts the clothing that survivors were wearing at the time of their assault to help dispel that myth. And so same thing, all this week actually is our What Were You Wearing week. And so if you check out our Facebook page, you'll be able to see that display in pictures instead of being able to see that display in person. And then we normally do one of our largest fundraisers in April called Unmasquerade, which is about unmasking some of the shame around sexual violence and bringing that violence into the forefront. And so we had to cancel that fundraiser for this year, but we've done a lot of information about that on our Facebook page as well that folks can follow.
Great. Yeah, it sounds like even regardless that all this is going on, that you have definitely stayed busy with
We
all the
have.
fun. Yeah. I can speak the same for us. We've been keeping busy, and that's good. That's good. Yeah, able to
Yes.
provide those services for people. Yeah, those are all the questions that I had. I didn't know if Ashley had any questions that she wanted to ask.
Sure. I wanted to ask something I've considered is with folks being at home, they might be in situations where the partner who they have experienced violence with, they're kind of essentially stuck in the home with that person. Or as you mentioned, oftentimes finances can be a part of this. And so people experiencing job loss or things such as that. What do you think might be some of the outcomes of folks being home and going through quarantine?
Absolutely. That's an excellent question. And it's definitely something that we have been looking at very closely, not only here in Wood County, but across the state. And what that means for us, one of the things that we have been hearing and seeing is that in other places who have been really going through the thick of the COVID crisis in our country, as well as in other countries, that we've seen an increase in domestic violence happening in those instances. We are monitoring very closely to see if that's going to be the case in the state of Ohio as well as locally. What I can say is that when you think about survivors who are in domestic violence situations, having the stay-at-home order is really kind of creating the perfect storm for them, unfortunately. So isolation and is a big risk factor for survivors of domestic violence, and we're essentially saying you should stay in your home, which is why we're really trying to get the message out that domestic violence survivors are exempt to the stay-at-home order and that nobody should have to stick it out if they feel unsafe in their home, and that we're here, our advocates are working 24/7, but that they can reach out to any place that they feel safe to try to get help. And you're absolutely right, the financial burden, the less financially independent that survivors are, a lot harder it is for them to make the decision to leave the situation, to seek safety, to be able to start out on their own. And so we've really been trying to continue to get the message out to survivors that we're here and that we can help, because it definitely does increase the risk factor and the danger for families who are stuck at home when the home prior to the stay-at-home order was already unsafe. And then we're putting those putting those extra parameters and restrictions on. I was in a meeting just the other day where they were talking about, the child abuse reports are also going down. And, the concern is that, the children are now in the home 24/7 and not being around other service providers who can potentially, report the child abuse that's happening or give that child an outlet, somebody that they can talk to about what's happening at home. So all of those things are very concerning to us. As a matter of fact, in the month of March, we saw a 40% increase in calls from domestic violence survivors reaching out. And so we know the need is there, and we want to continue to be able to help folks as the need arises.
Is there anything you encourage people, if they're worried about somebody else, how they can help somebody or how to kind of best respond?
Absolutely. One of the things that we're really suggesting is that if you have concerns about a loved one, please keep checking in with them in a way that's safe. So finding a safe way to be able to communicate with them. One of the things that becomes more difficult is that when domestic violence survivors are stuck in their homes with their abusers 24/7, it's a whole lot easier for abusers to be able to control their communications. And so, finding safe ways. I mean, is it texting? Is it calling? Is it chatting? What are those ways that it's safe enough for us to reach out, but to keep checking in with their loved one to ensure their safety. And if they need anything, we absolutely are open to working with and talking with family members as well. And so, a family member could definitely call us and say, I have these concerns for my sister or my brother, my mother, whatever that may be, and we can help walk them through some options. But being that source of connection for that survivor is something that's going to be really critical, so that if and when that survivor needs some assistance, they have sort of that lifeline of somebody that they can reach out to. That sometimes is safer. Sometimes it's safer if your calls are being monitored, it's safer to call mom than it is to call the Cocoon hotline. And so, helping to help that survivor navigate if they're finding themselves in those positions where they need to reach out for help. But we're definitely saying that, please, have some pretty continuous conversations with family members or friends that you may be worried about to try to help them in whatever way that we can. We are working really hard to help to ensure that any survivor in the community that does not have access to a phone or communication, that we can help them get that. And so we encourage folks to reach out if that's something that they're struggling with. We want everybody to be able to have a safe form of communication to reach out for help if they need it.
Thank you. That's really interesting. A lot of that I didn't know.
Yeah, that's really good
It's been
information.
interesting times for us to navigate too. The safety planning that we do on a regular basis with survivors looks very different. As we also think about how it works in the midst of a pandemic and a stay-at-home order, and all of these additional factors. And so it's been constantly changing for us too, and figuring out how to best meet the needs of the survivors in our community for sure.
Right. Well, does anyone else have any questions or any other comments, Kathy?
The only other thing that I would have, and then if you all have other questions, we have seen a slight decrease in sexual violence survivors reaching out for help, and we don't have sort of an easy pinpoint reason as to why that's happening. But our concern is that sexual assault survivors may not feel that the hospital is a safe place to go. We've been assured by the Wood County Hospital and that they put in, all of the safety and health protocols in place, that it is safe for survivors to go. And so we're trying to get that message out, that please do not go to the hospital, not go to the hospital if you need medical care. We can work together to try to ensure your safety and health at the same time getting you the help that you need. So that's another message that we're just trying to get out to the community.
Great. One last thing I did want to ask, how can people contact you if they need any services from the Cocoon?
So our 24-hour line is the best line, just because that will immediately get you connected to an advocate. And so that phone number is 419-373-1730, and then press option 2, and that'll immediately connect you to an advocate.
Great. All right. Well, thank you so much for being here with us today. Again, this is Kathy Mull, the Executive Director of the Cocoon. So thank you so much.
Well, thank you so much for having us. We really appreciate it.
Yeah, of course, of course.